I'm Shelby Jewell, and this is my synovial joint movement project. My brother Mitch is our actor here, and he is going to help show us some exercises to keep us calm and feel relaxed during these difficult and hard times. So, the first exercise that we are going to do are leg lifts. This will help to show flexion and extension. Flexion is a decrease of the joint angle, usually in the sagittal plane, common at hinge joints. Extension is a movement that straightens a joint and generally returns a body part to the zero position. So we can see flexion as he raises his foot and extension when he moves it back. Perfect. And now he's back in the anatomical position. Next, we are going to do arm lifts. This will show abduction and adduction. Abduction is a body part in the frontal plane a movement of the body part in the frontal plane that moves away from the midline of the body. Adduction is in the frontal plane back towards the midline. So we can see him being abducted as he raises his arms, and adduction when he moves closer to his body. The third exercise that we are going to do is for circumduction. One end of the appendage remains fairly stationary while the other end makes a circular motion. He's going to show this with his arms moving in a circular motion like a windmill. Perfect. All right, after that, he's going to do torso rotation. Rotation applies to any bone turning around a fixed axis. Movement in which a bone spins on a longitudinal axis. Perfect. All right, so the next one that he is going to show us will help us to understand supination and pronation. The forearm is a movement that turns the palm to face anteriorly or upward in an anatomical position. The forearm is supinated and the radius is parallel to the ulna. Pronation, the opposite movement, causing the palm to face posteriorly or downward and the radius to cross the ulna like an X. Perfect. The next exercise we will focus on will be for the dorsiflexion and plantar flexion. Dorsiflexion is a movement in which the toes are elevated as one might do in applying toenail polish. Plantar flexion is a movement of the foot so that the toes point downward, as in pressing the gas pedal of a car or standing on tiptoes. This motion also produces the toe off in each stop you take, as the heel of the foot behind you lifts off the ground. Perfect. All right, and then we are going to talk about elevation and depression. So for this, we are going to do shoulder lifts. Elevation raises the body part vertically in the frontal plane. Depression lowers the body part in the same plane. Perfect. All right, and the last exercise we're going to do is shoulder blade retraction and protraction. So protraction is the movement of a body part in the transverse plane. Retraction is a posterior movement. So for this, I'm going to have Mitch turn to his side, like so, and go. Yes, perfect. Great! Well, that is our exercises for today. We hope you enjoyed. I apologize for my beautiful dog being in the video and the whining of our foster puppies, but we hope that you enjoyed our video and that these movements will assist you in decompressing and de-stressing.